Level 1. The new grad. You passed the NCLEX on your first attempt. 85 questions. The screen went blank and you sat in your car for 11 minutes before you could drive home. 3 years of nursing school. Clinical rotations where you felt like you were always in the way. Pharmacology exams that broke people you thought were unbreakable. You did all of it. You passed. You are 23. Your first job is on a medical surgical floor at a regional hospital. Your base salary is $58,000. It sounds like enough until you calculate your student loans and realize it is exactly enough and nothing more. Your first shift, you have 6 patients. Your preceptor tells you the floor runs lean. By hour 3, you know what that means. It means when your patient in bed 4 pulls out his IV, and your patient in bed 6 needs pain medication, and the call light in bed 2 has been going for 9 minutes, you are the only person coming. You make a medication error in your 3rd week, a small one. You caught it before it reached the patient. You report it. You go home and sit on your couch and do not turn on the television for a long time. By month 6, you can read a patient's face from the doorway and know something is wrong before the monitor tells you. By month 9, the new grads are coming to you with questions. You answer them. You remember what it felt like not to know. You do not regret it yet. Level 2, the travel nurse. A travel nursing agency emailed you at 26. The rate was $2,800 a week. You did the math 3 times. You signed a year later. 13-week contracts, Phoenix first, then Nashville, then a level 1 trauma center in Dallas. Your total compensation this year is $114,000. The number does not look real, but it is in your bank account, which makes it more real. Travel nursing is freedom and loneliness in the same breath. You live in furnished apartments that belong to no one. You become very good very fast at every new facility because you do not have the option of being slow. The trauma center in Dallas does something to you. A 7-year-old on your 3rd week. You do everything right. It does not matter. You drive home at midnight and sit in the parking lot of your temporary apartment for a long time. You start seeing a therapist. She is the first person you have told about it. She asks how long you have been carrying that. You do not have an answer. Your savings account has more money in it than you thought you would have at 40. You are not sure what you are saving for. You are just moving. Moving feels safer than stopping. Level 3, the ICU nurse. You move into a permanent position at a teaching hospital in a major city. You specialize in the ICU. You are 30. Your base salary is $89,000. With night differentials and weekend premiums, you take home closer to $108,000. 2 patients instead of 6. But the 2 patients are the sickest people in the building. You manage ventilators, you titrate drips, you make decisions in seconds that a floor nurse would have 20 minutes to think about. You are good at this. You did not know you would be good at this until you were inside it. You mentor a new ICU nurse. He is 24 and afraid of everything, which means he is going to be fine. Watching him get better is the first time in years that something at work has made you feel something other than exhausted. A clinical educator position opens across town. More money, fewer nights. You think about it for 2 weeks. You decline. You are not done at the bedside yet. You are not sure when you will be. Level 4, the nurse manager. The position opened when your manager left for a director role at another system. You said yes before you finished thinking about it. You are 38. Your salary is $118,000. No more differentials. No more overtime. You are salaried now. The hours are longer. You manage 26 nurses. You conduct performance reviews. You handle HR issues you have no formal training in. You attend 3 times as many meetings as last year. You have not taken a patient assignment in over a year. You miss the bedside more than you expected. What you actually miss is being useful in a way you could see and measure. Managing a unit is useful in ways that are slow and invisible. 2 of your nurses are burning out. You can see it. You adjust assignments where you can. The staffing model does not give you enough room. You write a proposal for additional staff. It is not approved this cycle. You write it again for next cycle. Your best nurse leaves for travel. You hug her at the end of her last shift and tell her she made the right decision. You mean it. You spend the next week figuring out how to cover her patients. Level 5. The director of nursing, age 43. You manage 3 units now, 72 nursing staff. Your salary is $152,000 with a bonus structure that could bring you to $172,000 in a good year. You sit in executive meetings. You present data on quality metrics, patient satisfaction, and nurse turnover. You have become very good at presenting data. The turnover number is the one that keeps you awake. Your system loses nurses faster than it can recruit them. You know why? Most of the reasons are structural. Most of the structures are above your authority to change. You raise them anyway. Some things move. Most things do not move at the speed the problem demands. A health system in another state recruits you for a CNO role, full executive authority over nursing practice. The compensation is $215,000. You fly out. You like what you see. You come home and think about it for 3 weeks. You stay. The team you have built, the mortgage. You stay, and you are not entirely sure it was the right call. Level 6, the chief nursing officer, age 49, the CNO retired. They promoted you. You are 49. Your salary is $235,000. Bonus eligible up to 20%. Every nursing policy decision passes through you. Every sentinel event is yours to account for. You sit on the executive team with the CMO, the CFO, and the CEO. You are the only person in that room who has ever had a patient pull an IV out at 3 a.m. You remind them of this diplomatically when the conversation requires it. The pandemic years changed you in ways you are still mapping. You made decisions during that period that you will carry for the rest of your career. Some of them you would make differently now. You do not say this publicly. You think about it privately more than you would like. Your nurses are still burning out. The workforce looks different than it did 10 years ago. Younger nurses are leaving faster. The loyalty to institution that your generation had is not there in the same way, and you understand why, and you are not sure the institution has earned it. You say a version of this at a conference in Chicago. The room is quiet for a moment. Then people applaud. You have influence now. Real influence. You use it carefully. Level 7, the executive and advocate. Age 56. You consult. You sit on boards. You testify before a state legislature on safe staffing ratios. Your words become part of the public record. Nurses you have never met email you to say your work changed their career. Your compensation across consulting, board stipends, and speaking engagements is $285,000 in a strong year. The number is abstract. What is not abstract is the meeting you had last Tuesday with a group of nursing students who reminded you of yourself 33 years ago. Afraid and certain in equal measure, you told them the truth, not the comfortable version, that the system will ask more of them than it should, that the work will take things from them they did not offer, that they will have to fight for their patients and sometimes for themselves and sometimes for the profession itself, that it is worth it mostly. That worth it is complicated. That complicated is not the same as wrong. They listened, some of them wrote it down. The cycle. Right now, somewhere, a 23-year-old is sitting in a car in a testing center parking lot. The screen went blank at question 85. He does not know yet if that is good or bad. He is holding her phone. He cannot make himself look up what blank at 85 means. He already knows. Some part of him already knows. He has a job offer, medical surgical floor, regional hospital, $58,000. He has a plan, 2 years on the floor, maybe travel, maybe specialize. The plan is clean and sensible and does not account for the night he will drive home after losing a patient he fought for and sit in the parking lot and wonder if he chose right. He will choose right. The choosing right is not the hard part. He checks her phone. Passed. He sits in the car for 11 minutes. Then he drives home. The floor needs someone on Tuesday. It always needs someone on Tuesday. He will be there. The cycle continues.